Audible? Can you hear me?
Yes, sir.
Okay, great. Nice to see you on a Sunday. Thanks for sparing your time. Well, we are here to discuss a few things primarily related to your clinical practice. So obviously it's a professional discussion. My name is Cyril Kadam, and we'll be discussing few things. I'd like you to ask me as many questions as you can, so that the clarity is there with you before you go ahead with this or understand what the background is and why we are talking to you. Okay, I've been sharing some insights on this in maybe in the form of some posts and certain other write-ups as well. Not sure if you are an audience for those write-ups that I've been sharing all this while, but it primarily revolves around the neuropsychiatric condition which is right now prevailing in India, not just in India but across the globe. So I share with you an opportunity here. I assume all of you are BAMS graduates, and I thought it's better to work together and seek each other's assistance to grow and fulfill the requirements right now that the society has. So one, there is a moral, background to it as well. We being physicians, we being vaidyas, doctors. And second, yes, obviously money, which everyone needs to and should be so. It's a dual prong thing which is going to help us and the society. Is English okay with everybody?
Yes, sir.
Yes, for me.
Okay, great. So if you people are hesitant to talk or lend your voice, feel free to type it on chat so that I at least get a communication from you. Great, thanks for your response. So I'll be talking in English, so it's a universal thing. If at all you have certain questions, ask me then and there. Stop me and ask me questions if there is an ambiguity in the communication, or you feel that you need some more information on that particular topic then and there. Great. So while others would join, they would be having access to this webinar, so they can have their piece of whatever they've missed, and then they can ask me questions later on. Before I go ahead with the actual topic, something that you need to know, why am I talking to you? So I've been into the neuropsychiatry space for some time now. I've been teaching neuropsychiatry at a couple of universities. I've been practicing Yukti Sattva, which is a combination of multiple things. It's, I would say, the Indian. Okay, fine. Indian counterpart of integrated medicine. Okay, so when we say integrated medicine, it's what's the future of the upcoming times in healthcare. So there is nothing called Ayurved, there is nothing called allopathy or homeopathy. There's only medicine. Okay, and that medicine will use multiple schools of thoughts, including Ayurved. And Ayurved will be a huge, gainer in this. So I come from this background, and that's why I'm talking to you about the current scenario. And it's especially bad after the COVID thing. So if you see, it's a much underrated one, not just underrated, but also least understood, I would say, and one of the youngest sciences in medicine. So neuroscience in modern medicine as well is one of the youngest science. Okay, the brain is still being researched. You have so many ups and downs. You have so many contradictory things which are coming up every now and then. Okay, so there is very high level of ambiguity on how to, when to, why not to, why to, about the therapy aspect and the physiological aspect of the brain, the neurotransmitters, the circuits, and everything around the nervous system, right? So that's the reason you see the statistic where we're talking about the comparative prevalence in India. And if you see global, the picture does not change. Okay, rather, if you include some of the demographics, the disparity would increase. The mental part will be more so reflected. Now, you all know that in India, reporting one, and second, the importance to stats, that statistics is very least. So that's the reason you have the difference between diabetes and mental health is only 4%. But actually, I would say it will be more than 35%. When if there was a correct reporting system, second, a reliable statistical information that we had. Okay. So अगर अपने पास तो जनगणना का भी डेटा नहीं है, तो इसका डेटा तो चांस ही नहीं कौन इस पे पैसा डलवाएगा, राइट? सो मेंटल इश्यू स्टिल टॉप्स द लिस्ट. ओके. एंड द सैड पार्ट इज वी आर नॉट अवेयर ऑफ इट बिकॉज वो चलता है, एटीट्यूड है. वी आई डोंट मीन वैद्यस, ओके, आई एम टॉकिंग अबाउट एवरी सिंगल ह्यूमन बीइंग ऑन दिस अर्थ. Now, if you see, this is again age-old data. 8-9 साल का पहले का डेटा है ये. फिर भी it gives you an inkling where India stands in terms of the mental health disorders. Okay, you see the darkened portion. जितना dark ज्यादा है, उतना ज्यादा concentration है prevalence का. So you have huge number of occurrence in India. If you compare, rather the African sub-Saharan part as well is better than India. Okay. Then you also have the major part of China, the Northern America, which is also a huge problem. On the right-hand side graph, again, you see the darkened portion, which is the suicide rates. Okay, suicide rates is an indirect parameter which measures the mental condition of this demographics. Now, if you see again, India is there in the darkest portion. So we really have a problem at hand, okay, which is again seen from a state-wise perspective. If you see, you being, students and the practitioners of Ayurved, you must well be appreciating this statistic. Okay, the southern part, especially the coastal areas, you see on the left-hand side top one, that is the depressive disorders, which are seen the most. And at the same time, the other part that you're seeing here, just hold on for a second. The anxiety part. So the anxiety and the depressive parts, the occurrence there is more on the coastal aspects, right? And you know why. Okay, Ayurved does work, right? Even in geostatistics, Ayurved works. So Ayurved is the best solution at the end of it. Anyway, coming back. The rest two demographics also make a sense to you, but I would rather be, restricting myself to the first two graphs. That is the parts which are southern, below the plains of the Ganges, that is below Madhya Pradesh, that is Maharashtra, Telangana, Odisha, to a certain extent, West Bengal, Andhra Pradesh, Karnataka, Tamil Nadu. These are all endemics. Okay, endemics, and the prevalence is higher, right? Now we'll come to this relevance in a very short period. Now, in the past few years, the suicide data is more concerning, especially in India. The past 4 years, 5 years, from 2017 till date, if you see, this seen a steep rise. And if you've known the quota story, if you've known recent inclusions in the newspapers, what you see, recent day before, I guess around 3 to 4 days ago, I read an article which says a dad actually forced a child, or he beat the child who had appeared for the NEET and she failed, or she failed to qualify the NEET, and he beat her that much that she died. So अगर नीट का एग्जाम दे रहे तो 18 साल की बच्ची को पिताजी ने इतने मारा, अभी क्या बोले? That's not a suicide as well. I would say this is a homicide, right? Obviously, it's a homicide. So if you see profession-wise suicides also, or daily wage pharmacy earners, that's a different issue because they come outside of the gamut of even public health as well. Because public health में infrastructure के बारे में मैं बाद में बात करूँगा. But what will be the self-employed professional students put together number that accounts to the largest number of people who are affected? Largest numbers. Okay. And if you see, students who are competing, they are most vulnerable, especially in the board exams, especially in the competitive exams like IIT, JEE. Every father and mother want their child to be professionally developed. So there's a huge amount of pressure. Because thousands में seats हैं medical का, लेकिन 24 लोग अटेंड करते हैं। आईआईटी में भी तो उससे बदतर सिचुएशन है, लाइक वो सीए का भी। This right-hand side evidence-based risk factor for suicide in across lifespans. If you see childhood, adolescence, adult, older, no one is spared. No one is spared. You interview, I've been interviewing, I've been doing I've been talks with the parents who come to me along with the kids. Not small kids, I'm talking about kids who are 18 to 25. Okay. उन्होंने जो बचपन में वो बच्चों के साथ जो बर्ताव किया उनको भी पता नहीं। उनके माँ बाप ने यानी बच्चे के दादा दादी ने या फिर ग्रैंड पेरेंट्स ने जो बर्ताव किया वो भी उन्हें पता नहीं है, जिसके वजह से विच वी कॉल एस ट्रॉमा, अर्ली चाइल्डहुड ट्रॉमा, नो वन इज अवेयर. सो one is the stigma part. Stigma is one thing which is there across the globe, but more so in India because कोई सब लोग पहले ये पूछते हैं वो मेंटल हो गया क्या, वो मानसिक रूप से, ये words they are stigma, so they don't want to listen to it. Same thing is there in the corporates. I've been working in the corporates as well. Okay, this is, I would say, again an underreported data these days. There are people who are coming out and stating their problems. So on an average 48% global, see India 58%. So we are again beyond what the current average of the globe is. So we are again at a high risk in terms of collapsing. So which means what? Which means that psychiatry is a problem, mental health is a problem, and mental health is a problem. But do we have a sufficient amount of infrastructure to deal with it? The number of psychiatrists that we need, which I had shared earlier, is much, much higher than what we have right now. Okay. We don't have that many number of psychiatrists, which the WHO's prescribes as 3 per 1 lakh. India has less than 1 per 1 lakh. I'm talking about the modern medicine का psychiatrist. Okay, the MD and the DPMs. वो भी नहीं है काफी. It's not a question of where, when we say Ayurvedic neuropsychiatry, it's not a question of a competitive scenario or a competitive platform. It's a collaborative platform. Okay, we are here to make sure, one, we all can fill that gap. That is a gap of 0.75 psychiatrists per 1 lakh patients versus 3 psychiatrists that we need. Does it mean that we all would want to become psychiatrists? No, but at least we can do whatever we can at the level that we are working, that is at a primary care, and people who are doing consulting with Ayurveda, they can at least contribute, right? इसी में क्या होने वाला है, by default you are going to earn, and you are going to earn better. Why? Because it is a niche. It is a niche science. Not many people, one, are interested. दूसरा, if they are interested, they find it difficult from a perspective of neurology, right? And because of which the entry level barrier becomes a bit higher. Now, absolutely right, Dr. Gansha. People are afraid to visit psychiatrists. I'll tell you certain of my experiences. You'll feel bad about it. And just before starting this session, one of the Vaidya groups that I am in, they shared a video about a very bad experience of a patient in Thane, where I stay. Thane is in Maharashtra, and of Panchakarma. Okay, that is of Rakta motion. I was so much, I couldn't digest it properly. Bad experience, right? तो ये सभी से होता है, उसलिए मेरा इंटेंशन यही है, and that's the reason that I've put up so many training programs. We need to be informed. We need to be in a position to talk to our patients, to gather the trust, to make sure that Ayurveda is put in the right stride in terms of, one, not just the terminology, but also the real content, the real depth of Ayurveda. ओके, ये हमको समझना है. समझने के बाद अगर पेशेंट के सामने उनको समझने लायक कंडीशन में हम लोग ने प्रेजेंट किया, नथिंग इज गोइंग टू स्टॉप. द फर्स्ट क्वेश्चन दैट पीपल आस्क इज, अच्छा ये न्यूरो साइकेट्री आप सिखाओगे, आप सब करोगे, तो हम लोग को प्रैक्टिस करने के लिए आरसीआई का रजिस्ट्रेशन लगेगा क्या? इन द फर्स्ट प्लेस आई आस्क यू, वर वी ट्रेन्ड इन आयुर्वेद? यस, वी वर ट्रेनिंग. डिड वी हैव चरक संहिता? यस. डिड वी हैव सूत्रस्थान? यस. डिड वी स्टडी मानस रोग? Was Manasroga part of a syllabus? Do you have anything as an outlaw or an outlier in terms of the content of your syllabus की? आप सब कुछ सब कुछ ट्रीट कर सकते हो लेकिन ये नहीं ट्रीट कर सकते, ऐसा कहीं on no condition have you been certified to treat human beings from an Ayurvedic perspective. I am not talking about including say escitalopram or things of that sort. No, I'm not talking about haloperidol. I'm talking about Ayurveda. So now what certification do you need? Why do you need an RCI person to come and tell you, okay, go and treat anxiety? No, you are authorized to treat anxiety. From a perspective of Ayurveda, you give whatever name that you want, what Ayurveda prescribes for it. Okay, you talk about Unmad and treat Unmad. Okay, so लोगों को why I am saying this is people have some some ricochet element in terms of psychiatry, in terms of neurology. Now, let us see what is the currently available set of solutions. One is the drug therapies that modern medicine has, allopathic psychiatric drugs. Second is the psychological counseling that psychologists do, that is BSc psychology, MSc psychology, MA psychology, right? MA, BA psychology. These psychologists who talk to people. So there is a difference between psychiatrist and a psychologist. So both of them need to be working in tandem for one patient. And the huge gap here is the psychiatrist is working, the psychologist is working, and they don't know each other. Right? That's the main problem. The wonderful thing that has happened with Ayurveda graduates is you were born and brought up when you started your BAMS studies as a unified person, both as a psychologist and a psychiatrist. Right? So that's a huge advantage that you have. Third, available things are the mental rehab centers and the asylums, which is in a pretty bad state. Everyone knows that. Not many, what? No one wants to go there. There are people who are staying there for 14 years, 15 years. One of my BMS friends who's a well-reputed Panchakarma specialist in Mumbai, she had asked me to see her nephew admitted at one of the hospices or an asylum in Pune, saying that आप कुछ कर लो, पंचकर्म कर लो, कुछ कर, हम लोग परमिशन निकालते हैं. And that patient is there for the past 15 years. Young person, आज का उनका उम्र कुछ 34, 35 है, तो कभी admit हुआ रहेगा? 15 years minus करिए. Okay. Then in the corporates, your wellness program, all these wellness programs are done people by corporates. So these, at the helm of these wellness programs are people who are not doctors. Okay, they are people who have done MBAs. Okay, who want to make the essence of time, who want to mint and take the advantage of this time. What is the time? People are having mental issues, or wellness is also seeking the psychiatric perspective. I just published today morning about sleep, probably yesterday, I'm not so sure. Now, what are the challenges with the available solutions? The first challenge that we have is the stigma, which is not a matter of Ayurveda or modern medicine. Okay, everyone who will deal in mental illness will obviously have to deal with people saying that I don't want to see a doctor for this. Okay, there is a stigma associated with it. People will not give you reviews. People will not give you testimonials. I tell you with my experience in the past so many decades, they don't want to give testimony. Why? वो टेस्टिमोनियल ठीक भी हुआ, आपसे कुछ भी दवा आपने यूज किया, वो ठीक भी हुआ, तो वो बोलेंगे नहीं. क्यों बोलेंगे? They don't want to, because they don't want to reveal that वो बीमार थे, साइकियाट्रिस्ट के पास गए थे. Right? Many questions thus far. Is the language okay? Am I fast? Am I slow? Am I relevant? Should I continue? Okay. I think not many are able to hear me, or probably am I not? मेरी language okay है? Should I include some other language? Okay, fine. ठीक है, चलेगा. No problem. So I'm continuing. So this is the status that we are right now. We do not have people. We are hardly having any healthcare around mental illnesses. देखिए ना क्या क्या स्टेटस है. 0.95 साइकियाट्रिस्ट वर्सेस 3 per lakh. साइकोलॉजिस्ट को तो उनका तो बहुत बेहतर हाल है. Then the next problem that we have is the literature. I mean, the RCTs themselves, they say that जो कुछ available antipsychotics बोलो, anxiolytics बोलो, stimulants बोलो, most of them are working symptomatically, and they are usually not benefiting more than 60% of the patients. There are 40% of the patients जिसको दवा दे के भी फायदा नहीं हो रहा है. इसका मतलब क्या, एक तो पहले लोग जाते नहीं है डॉक्टर के पास, जो जाते हैं उसमें से 50% या 40% लोगों को फायदा नहीं होता है, तो इनको they just left into the dump. That's the current situation. And whoever start the treatment, there are two problems. There are three problems. One is the side effects. And I tell you, there are really bad side effects. Right from weight gain से लेके दिन भर सुस्ती रहना and making a person vegetable. ये साइड इफेक्ट से लेके ड्रग डिपेंडेंसी, अगर आप वो भी नहीं खाओ ना तो आपको और भी तकलीफ होती. तो I've seen patients who haphazardly they want those drugs. I'm weaning them. So there are so many patients I've weaned them. Okay, latest one, I'm weaning a patient from Jabalpur. Okay, उसको almost like 1/10 of a dose लाया है तीन ड्रग्स का. ठीक है, एक सिम्टम आया ना उसको, एक सिम्टम विच इज बिकॉज ऑफ वेरियस रीजंस नॉट रिलेटेड टू डिक्रीजिंग द डोसेज, ही बिकम सो हाइपर. नहीं सर, वो दवा 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 दवा. ही दे आर so much dependent psychologically as well. Thought process ऐसा उनमें डिपेंडेंसी का बना के रखा है, right? And because of it, their quality of life is really bad. And I tell you what, the age of the patient these days, or the demographics, that is, patients between the age of 18 to 30s have increased a hell lot. And imagine their quality of life being affected. Because of which, और एक बात बताऊं आपको, साइकेट्रिक इलनेस ऐसा होता है ना, आपको कोविड से भी बदतर है. साइकेट्रिक इलनेस में वो एक पेशेंट ही खराब नहीं रहता, वो पूरा फैमिली बर्बाद होती है उसके साथ, पूरा फैमिली बर्बाद हो जाती है. एंड जैसे कम्युनिकेबल डिसीज है, वैसे ये भी कम्युनिकेबल डिसीज हो सकता है. Okay, because of the behavioral shift that happens in the house because of that patient. Now the asylums are subpar. I don't need to talk about that. Now these counseling and wellness programs, उन लोग क्या करते हैं, they have a very small limitation of their extents. They will talk behaviorally, they will talk not aligned with the treatment that is happening. That is the second issue. तीसरा जो है वो रूट कॉज पे नहीं अटेंड करता, वो रूट कॉज पे नहीं अटेंड करता. They would want to use tools जैसे EMDR है बोलो, या so many tools that we have, but रूट कॉज क्या है, पेशेंट बाद में आके बोलते हैं एक्चुअली वो डॉक्टर को समझा ही नहीं मैं क्या बोलता है. I mean, I have a study where the patients have said the doctor did not understand what I meant to say. So what do we actually need is awareness by default, so that we erase the stigma. Second is outreach बढ़ना चाहिए, and this is primarily the motive that I would want all the GPs, not want, I wish that the GPs and the network of Ayurved graduates help us with this. Okay, अपना outreach बढ़ना चाहिए at a primary level, like a secondary level. Okay, then we need to have a therapeutic approach which is holistic. It is not neurotransmitter which is causing a illness. It is not dopamine. No, dopamine is a mediator. There are so many. अभी भी कितना पोस्ट आता है, कल देखा पढ़ाई के लिए तुम लोग को ये करना है ना, तो एसिटाइल कोलिन है. अरे क्या एसिटाइल कोलिन है? एसिटाइल कोलिन इज अ मीडिएटर, उसका रूट कॉज अलग है. ओके, एंड देन पीपल गेट लाइक्स. आप ज्यादा टेक्निकल यूज करते हो ना, गेट लाइक्स. Then you need that holistic triad here. What is the triad? Body, mind, and spirit. ये triad जो है ना, it needs to be banged on the heads of every single human being living on this earth. Everyone wants very much objectivity, and there is no objectivity. Okay, that is because of the reductionist science. दूसरा, ये preventive medicine जो है, fifth point, preventive medicine, that needs to be pushed. And then self-awareness. Facilities by default उसको तो time लगेगा, but at least we will do the first 4 to 5 that I think we can do together. So what do we offer? That is Genesis Positive Health MindCare clinics. We offer awareness programs as well. There are so many free webinars we do. We do celebrations where we offer free programs. Okay, there are screenings that we do free, both in corporates as well as in the public domain. Then we have holistic integrated therapies that we are providing. Okay, जिसके अंदर one of the platforms that we are using is the gut microbiome correction platform. Okay, GPH is primarily into integrated medicine. So I usually would want to use words, terminologies which the patients would understand because they've been trained right from class KG till their graduation in the terms of English, in the terms of modern chemistries and modern biologies. So if I do a procedure of bloodletting, or I usually don't do bloodletting. Okay, रक्तमोक्षण मैं नहीं करता, बाकी के पंचकर्म में करता, जलाव का मैं नहीं करता, right? But if I do Shirodhara, I need to make sure कि उनको stapni मर्मा का meaning मैं बता दूं. The confluence of two sinuses that are happening, which are affecting the free fluid flow of the CSF. And how does it affect? How does it affect? Okay, in the washing out of the excreta, there is the unwanted digested particles. Second, I need to make sure that I make them understand what is dysbiosis, what is arm, what is pitta darakala. What do you mean by having a metabolic syndrome? Why does metabolic syndrome, cancer and mental disease go hand in hand? ये मैं उनको बताए बगैर मैं उनको आयुर्वेद नहीं सिखा सकता, नहीं बता सकता, उन लोगों को नहीं समझ में आ सकता. तो एंशियंट विजडम है, या वी आर प्राउड, बट हम लोग को उसको लैंग्वेज में ये यूज करना है कि वो मॉडर्न मेडिसिन के जो लोग आदत पड़ चुकी है उनको समझ में तो आए, पेशेंट्स को, तो वो अपनाए. So the recent video which I said I was very disturbed is that doctor who's an Ayurved graduate says to the patient, and I quote, this is just what the patient has put a video on YouTube. I'll share that video with you. वो पेशेंट को क्या बोला, मुझे आपका ब्लड का टेस्ट करना है, और वो अंदर लेके जाके ब्लड टेस्ट करा. ब्लड टेस्ट करा, क्या किया, एक वेन फ्लो लगाया उसने, ओके, क्यूबाइटल फोसा में, और ब्लड लेटिंग कर रहा था. लेकिन वो पेशेंट का समझ में नहीं आया. बाद में उसको समझ में आया कि वो ब्लड लेटिंग है. 70 to 90 ml ब्लड निकाल, और बाद में वो ब्लड ऐसा देखा किडनी ट्रे में, और बोला कि ये प्रकृति है आपका, ऐसा वो पेशेंट बोल रही है. नहीं, वेयर इज देयर द फॉर्मल the informed consent concept here? Why do we not make people understand? राइट, ये सब बताना बहुत जरूरी है. राइट, तो या हम लोग को अपनी चीज करनी है, लेकिन आज के दौर में जो चल रहा है उसके हिसाब से करनी है. आपको इन्फॉर्म कंसेंट लेनी है, लेनी है, लेनी है, सवाल ही नहीं है. पंचकर्म करो, या इवन ड्रग्स पे भी डालो, ड्रग्स पे डालो, आपका जिम्मेदारी है कौन सा ड्रग आप बता रहे हो उनको, कौन सा दे रहे हो, और वो क्या करने वाला है. आज का पेशेंट मुझे पूछता है, और मैंने आदत बनाई है मेरे पेशेंट्स को कि मैं ये ड्रग यूज करूं, उसका रीजन ये है. तो ड्रग का नाम बोलने का जरूरत नहीं, बट कैटेगरी ऑफ ड्रग्स इज व्हाट वी नीड टू टेल. राइट, we also are into preventive health care, and more importantly, when I said integrated, I use music therapy, I use meditation, I use mudra discourses, and I am very vehemently pushing diet, sattvic diet and lifestyle. So usually I have an IPT, so I make sure that I at least tell them the nuances of being in IPT, so that दिनचर्या उनको मैं सिखा सकूं, या उनको मैं बता सकता हूँ, जिसकी वजह से उनको फायदा होता है, तो घर में यूज कर. गंडूस में एवरी पेशेंट एडमिटेड स्टार्ट्स द डे विद द गंडूस कवल, कवल से चालू करते हैं, और वो घर में जाके कवल सालों साल करते रहता है. राइट, सो दिस इज व्हाट वी आर ऑफरिंग. एंड व्हाट आर द सर्विसेज छोड़ के हम लोग का सॉल्यूशंस क्या है. तो वी हैव समथिंग कॉल्ड द साइकोमेट्रिक एनालिसिस फॉर चिल्ड्रन, फॉर स्टूडेंट्स, व्हिच इज पार. देन वी हैव साइकोमेट्रिक एनालिसिस फॉर एडल्ट्स, जस्ट कि आपका प्रकृति क्या है समझने के लिए. लेकिन इट इज अ मिक्स्ड बैग. मिक्स्ड बैग यानी कि हम लोग ने कॉन्वर्जेंस किया है मल्टीपल थियोरीज का, जिसके अंदर एमबीटीआई है, डिस्क है, प्रकृति है. सो यू गिव अ कंप्लीट पैकेज जहां पे आपको उनका मानसिक स्थिति क्या है वो समझ में आती है. That psychometric analysis is called Manahasthiti, which is a combination of multiple different modalities of psychometrics. तो आपको you get a correct understanding of the patient's psychometric background. ठीक है, ये दो डायग्नोस्टिक है. बाकी के जो है वो दो सार, एक तो रेमेडियल है या प्रिवेंटिव है. So progressive life coaching is a remedial thing, which is life coaching including psychiatry, psychological services for students. There is a brain booster program जो हम लोग स्पेशली जो कॉम्पिटिटिव एग्जाम्स में जो परफॉर्म करते हैं, वो बच्चों को 4 मंथ का एक प्रोग्राम देते हैं, जिसके अंदर थेरेपीज रहता है. राइट फ्रॉम शिरोधारा है, स्नेहन स्वेदन से लेके शिरोधारा से नीचे नस्य से लेके अभ्यंतर पान है, कुछ मेडिकेशंस है फॉर 4 मंथ्स, मेद रसायन है, likewise, and we've got excellent results. That is called the brain booster program. Then we have consultations, then we have residential therapy program, जहाँ पे हम लोग पंचकर्म करते हैं, CBTs करते हैं, REBTs करते हैं. So CBTs are cognitive behavioral therapies, REBTs is rational emotive behavioral therapies. Then eye movement के लेके हम लोग एंजाइटी को हेल्प करने के लिए EMDRs यूज करते हैं, right? And we are also into corporates where we provide corporate well-being programs, but from an integrated perspective. That is, Ayurved use करते हैं, and at the same time we use diagnostic modern medicine का tools as well. Okay, only from a perspective of understanding the patient, but therapy primarily Ayurved. Unless and until there is a surgical outcome that we see and we refer it to surgery. Okay, acute रहेगा तो. Now look at the Indian market that you see. आपको when I say there's an opportunity, the Indian market is 43,000 crores. I have updated it maybe 1.5 months ago. Indian market size is 43,000 crores. और मैक्सिमम नंबर ऑफ पेशेंट्स कहाँ पे है? महाराष्ट्र में, कोंकण में, केरला में, तमिलनाडु में, ओडिशा में, कर्नाटक में, राइट? नीचे का पैराग्राफ मत देखिए, दैट इज ओनली us, but I'm talking about you. Over a period of time, we at Genesis, we are looking at having multiple centers. Okay, we are looking at centers across the states and the cities which have the highest patients. So around Thane, Mumbai, Pune, Hyderabad, Bangalore is that we are looking at. Okay, that's a. Now, does it make sense? Actually, yes. Till the time that I'm showing you some statistics which is related to income. When we did only this is only psychiatric revenue, only psychiatric revenue. Look at the jump from April 23-24 to March, April 24-25. There is a 110% jump where we started exclusive Panchakarma only for Ayurvedic neuropsychiatry. And this is, I'm just showing you the segment of only neuropsychiatry. I have excluded all the other, what do you say, treatment modalities for other systemic diseases. This is, I have segregated information only for psychiatric treatments that have happened at our center at Thane. Itna jump ho gaya hai. Now, do you want to capitalize? Do you want to capitalize on this situation where, one, you have a chance to do whatever is required for the society? Second, you should be earning more. Can we have the first poll, please? I would like you to answer this question so that I can help you understand what the next thing that I'm going to explain. Can you please respond to this?
Yeah, I've launched the poll. Can you all see it? You all can answer, choose.
यहाँ पे है ना, डोंट वरी, यहाँ पे नाम किसी का डिस्प्ले नहीं होता. ओके,
Yeah.
गेट टू नो द काउंट, सो डोंट बी एम्बैरेस्ड टू फील एनीथिंग. Just click on whatever the best answer is that you feel you want to share. Okay, should we move? Did we get the count?
Only three have answered so far.
Oh, so you have to click on whatever the best option you feel. The question is, आप पेशेंट कितना देखते हो, तो आपको क्या लगता है वो आप डाल दीजिए. जो
Yeah,
नंबर है वो डाल दीजिए. आपको आपका नाम हमारे पास नहीं आता. हम लोग को इतने लोगों ने इतना पेशेंट देखा है वही सिर्फ आता है. जैसे 4 ऑप्शन दिया, तो पहला ऑप्शन जो कुछ है एक्स से लेके वाई तक, उसमें कितना लोगों ने यस बोला है वही आएगा. सो डोंट वरी, वी डोंट वांट टू गो इनटू योर फाइनेंशियल डेटा.
yeah. So 4 people have answered. Rest 5 people, if you can answer.
But we have okay.
Total 9 participants.
Anyway, so please do that so I can move. There is a lot to discuss because this is just the introduction.
Are you all able to see the poll? सबको poll दिख रहा है क्या? कुछ difficulty है poll दिखने में? How many patients do you see per day? And there are 4 options. Or you can type in the chat box if that helps your answer. If you're not able to select. I hope all are listening Sunday afternoon. Okay, so
Okay.
five people answered.
Okay, let's move it.
So I'll end the poll.
Yeah.
Okay. Yeah, so I have ended it.
Okay, thank you. So we'll move ahead now. Now, if you feel you want to capitalize, the first question is how to capitalize, right? In the current scenario, how do I capitalize? You have a lot of options. Okay, in the first place, why to capitalize and where to capitalize? You have these places. One is the quantity of people who are catering to these needs. यानी psychiatrists जो है we have very less. We need more people to practice, right? We need more psychologists. So it means if you are a combination of a psychiatrist or a psychologist and a psychologist, I would say, then you are the right person to be entering into this. Second, the drugs are not beneficial to more than 40% of the patients who are suffering. Third, there is a drug dependency. And fourth is patients develop side effects which are concerning that are affecting the quality of. This is where you can capitalize. Why? Because Ayurved is the provider. You, as a person, is the provider who can fill this gap. Why Ayurved? But because holism is the only way to heal mental illnesses. Today, I had a patient who's from the team which does raids. Okay, वो sales tax में वो जीएसटी में रेड्स करने का टीम में है. He is so frightened by even the fact that a message comes. ओके गए 2 दिन से आ रहा है मेरे पास उनको मैंने पंचकर्म चालू किया है. ओके सो आई टोल्ड हिम कैटेगोरिकली भैया मेडिसिन वन पार्ट है पंचकर्म दूसरा पार्ट है तीसरा काउंसलिंग है. ओके वी नीड टू टॉक वी नीड टू डू सो मेनी थेरेपीज. ओके जिसके अंदर सीबीटी रहेगा आरईपीटी रहेगा राइट. एंड देन वी नीड टू ऑल्सो मेक श्योर दैट आपका लाइफस्टाइल और आपका सर्केडियन रिदम रीएस्टैब्लिश होता है करेक्टली. So that is what we call as holism, right? And we are, that is Ayurveda is that therapeutic intervention which is based on holism. More importantly, preventive medicine is the core of Ayurveda. That's the reason हम लोग दिनचर्या और ऋतुचर्या we use it and we use it efficiently for these patients so that we use it as a tool for ना पुनर्भव चिकित्सा. राइट बिकॉज आधा सा ट्रीटमेंट छोड़ के फायदा नहीं है. हम लोग को उनको लाइफ कैसे जीनी है वो सिखानी है. नॉट जस्ट विद दिनचर्या एंड ऋतुचर्या बट ऑल्सो विद लाइफ कोचिंग. दैट्स वेयर द स्वीट टेस्ट इज. दैट्स वेयर वी कॉल इट एज इंटीग्रेटेड थेरेपी. राइट. नेक्स्ट वी डोंट हैव दोस ग्रॉस एडवर्स रिएक्शन जैसे वेट गेन होता है. ओके बम्प आ जाता है. ठीक है दिन भर वो नींद के कंडीशन में रहता है ग्रॉगी रहता है. वी डोंट हैव दैट. And past so many years we've been treating this. You can see our website. Uske andar there is something which is a page dedicated to testimonials. I would like you to go to that. Right from pure anxiety, fear, up to the level of schizophrenia, bipolar disorder. We have those patients who have shared their experiences with us on the internet and purely using Ayurveda, Panchakarma, and integrated therapy. But what type of Ayurveda? As I said some time ago, Ayurveda which is not presented as obsolete or godly nature or of abstract ideas. No, not that Ayurveda. वो लेके जाओ तो people वैसे भी psychiatry के पास नहीं आते. ऐसे words use करते फिर से नहीं आएंगे. We want Ayurveda to be presented as a relevant scientific knowledge. Okay. यूजिंग साइंटिफिक वोकेबलरी. उनके लिए कुछ जो साइंस है वो ऐसा नहीं कि हमारा साइंटिफिक नहीं है. हमारा भी साइंस है हमारा भी साइंटिफिक है. लेकिन उनका साइंस क्या बोलता है गट माइक्रोबायोम बोलता है. उनका यानी किसका कॉमन मैन का. आई एम नॉट टॉकिंग अबाउट एलोपैथी. कॉमन मैन का उनको गट माइक्रोबायोम समझ में आता है. ओके उनको फाइटोकेमिकल समझ में आता है. उनको द्रव्य ये वर्ड यूज करेंगे तो बोले अरे यार क्या पिछड़ा हुआ है कहाँ पे आया. द्रव्य नहीं फाइटोकेमिकल्स इन दोस्त शतावरी आप यूज करो. ओके, आप वो बात करो, कौन सा अल्कलॉइड है वो यूज करो, लाइपोसोमल ड्रग डिलीवरी यूज करो, नैनो मेडिसिन यूज करो, आप जब आप पंचकर्मा की बात करते हो, राइट? आप जो तैल यूज करते हो, वाई इज तिल तैल यूज एवरीवेयर? व्यवाई है मत बोलो, डोंट यूज व्यवाई, यूज लाइपोसोमल ड्रग डिलीवरी सिस्टम देर, यूज स्रोतस, स्रोतस मत यूज करिए, माइक्रोट्यूब्यूल्स यूज करिए, चैनल पंप्स यूज करिए, सोडियम चैनल, पोटेशियम चैनल यूज करिए। तो लोगों को बोलेगा अच्छा ओ ओके, उनको 1+1 2 कैसे आता है वो आप समझाइए, तो दे विल बी attracted, they will want you, because this is holistic science. Okay, and they want people, that is they want vaidyas who are incorporating not just one stream, they are incorporating psychology, psychiatry, life coaching, emotional intelligence, all these knowledge bases together along with the knowledge of Ayurveda. That is what is called as a person who can resist anything, any competition, anyone in this world. And why you? You are trained actually in this, all of this. You are trained. And if you are not trained, the rest of the training we will do. Don't worry. ओके, प्रिवेंटिव मेडिसिन आपके पास जो कहीं पे नहीं है, कौन से भी पैथ में नहीं है, नाइदर होम्योपैथी में नॉर मॉडर्न मेडिसिन। आजकल मॉडर्न मेडिसिन ने कुछ एंसिलरी प्रोग्राम्स उसके अंदर ऐड किया है प्रिवेंटिव मेडिसिन का। ओके, नाउ यू अगेन आर अ कॉन्फ्लुएंस ऑफ अ साइकियाट्रिस्ट एंड अ साइकोलॉजिस्ट, व्हिच इज द नीड ऑफ द आवर. And because you're working at two levels, probably we have people who are doing GPs as well here, right? So you are the people who are seeing the maximum number of patients more than consultants. I mean, आपका reach जो है, dense reach है. So you can influence the market more. Most importantly, more than consultants, आपका जो पेशेंट का जो रिलेशनशिप है वो मच मोर स्ट्रांग है। आपके पास आपने जो ट्रस्ट बिल्ड किया है ना ओवर द इयर्स, दैट इज मच बेटर देन अ कंसल्टेंट का ट्रस्ट. So are you ready? If you are ready, then what we are providing is onboarding program. We are providing you with an onboarding program comprising of 6 things. One is we provide you training in both the IU, that is the allopathic and Ayurvedic aspect of neuropsychiatry. This is a 100-hour training program that we have designed only for onboarding you. Okay, I'll tell in detail about this training program, kya hai, kaisa hai. Next, we have some tools that we are going to share with you. ऑनलाइन प्रकृति का असेसमेंट है, आपको कुछ नहीं करना है, विद इन 2 minutes you get to know the prakriti of that particular patient. Okay, there is a diagnostic tool. ओके, आप आपका परीक्षण करिए, अष्टविध है, षडविध है, चतुर्विध है, जितना पॉसिबल आप आपका परीक्षण कर लीजिए, नाड़ी परीक्षा करिए, दोष धातु मल देख लीजिए, एंड यूज दिस टूल. यू शुड नॉट बी वरिंग अबाउट द एक्यूरेसी ऑफ योर डायग्नोसिस. सो आपका डायग्नोसिस आपके सामने आएगा, डायग्नोसिस आएगा, वो टूल के अंदर ऐसा है, आप डायग्नोसिस आएगा, प्रकृति उसके साथ आप डाल दो तो आपको रिकमेंडेशंस ऑफ मेडिसिन भी आ जाएगा, कौन सा किट यूज करना है. And those kits we will be shipping it to you. You don't have to worry. आपका ओपीडी का मेडिसिन देना है, we will be providing those medicines to you. आपको उनको पंचकर्म करना है because case is too refractory and इसके पहले दवाई ले चुके हैं या यंग पेशेंट है, आगे पूरी जिंदगी पड़ी, आपको लगता है पंचकर्म देके मेटाबॉलिक सिंड्रोम भी है उनमें, वो भी आप ठीक कर सकते हो. ओके, अदर कॉम्प्लिकेशन दूसरे स्रोतस का हुआ है तो go for panchakarma. We will give you those panchakarma kits as well. You don't have to think, burn your brain on that. Okay. And the last thing is, जब आपका पेशेंट एनरोल होता है सिस्टम में, बाय डिफॉल्ट उसका प्रकृति के साथ उसका लाइफस्टाइल का चार्ट और उसका डाइट चार्ट आपको मिलेगा. सो देन व्हाट डू यू नीड टू डू? जस्ट मास्टर द ट्रेनिंग, मेक श्योर दैट द असेसमेंट टूल्स एंड द आउटकम इज मैचिंग, एंड गिव मेडिसिन. That's what is left at your end now. We've made it simple for you. What is this training program? 100 hours. It has basically these 5 modules. The first module will talk about the basics, right from cellular biology to the anatomy, physiology, biochemistry, the axis, okay, emotions. Then the pathophysiology of dysbiosis, nature versus nurture. This is the psychological aspect of the pathophysiology of nervous disorders or psychiatric disorders. Then we are going to talk about the pathophysiology around genetics and epigenetics. There'll be assignments. And at the end of the module, you'll be having a test. The next is about the disorders, where all the disorders, along with the Ayurvedic concept of Unmad, will be detailed here. You will have assignments. as well as here there will be 2 assignments, as well as you will have even the final assessment. Then we are going to tell about psychometrics. What are the basic types of personalities? How do you measure? What is MBTI? How do you measure Ocean? How do you measure type A and B? If you are interested, we can give you the tool of psychometrics as well. There will be an assessment along with the module. The end outcome that is expected out of this is by interviewing a patient for maybe 15 to 30 minutes, you should be able to understand what is the phenotype and the genotype. That is the constitution of that particular patient. Then we come to therapeutics, right from the modern aspect up to Ayurvedic medications, the drug delivery systems in Ayurved, which is right from the, as I said, liposomal drug delivery systems, Panchakarma, gut का कैसे affect करता है, okay, blood-brain barrier को क्या करता है, and the role of Panchakarma in neuropsych, along with Sattva Vajay, that is covered in neurotherapeutics. And non-pharmacological interventions, these are very important, right from yoga, music, diet, lifestyle, the CBTs, REBTs, EMD. We will train you into how to do CBTs, REBTs, EMDRs. Okay. We will be talking about the art of counseling, most important. Emotional intelligence. We have a master in emotional intelligence who is my co-host today. She is the person who's going to talk about the next 2 topics. That is emotional intelligence. She's going to train you on that. And she's one of the world's first university graduates, postgraduates, I mean to say, a master's in emotional intelligence from the University of Mumbai. And then she'll also teach you about life coaching. She'll make you a life. She is a certified life coach. Okay. And then we are having some tools that we will be sharing with you. One of the tools will be a journal. Okay. We'll share you how you can share the journaling aspect with your patients and how you can track that journal and how you'll be able to understand how much is the improvement. Okay. That's included in your non-pharmacological interventions for psychiatry. We'll have an assessment along with 2 assignments. Assignments will be more related to practicals than theory. There are certain aspects where theory will be important, like the pathophysiology part, but from a non-pharmacological interventions, from neurotherapeutics and from psychometrics, we will be having more of a practical approach. Okay, assignments will be more practical oriented. CEX is what we call. Okay. To be a part of this, you'll have to pay a fee of 28,750. The onboarding facilitators will be me and Sarika Desai. How will you increase your clinical revenue? Okay, you have 4 different quadrants. For general practitioners, you have your existing patients. That's the reason I asked you how many patients you see on a day-to-day basis. I would have given you a much better picture if you had given me the answers. Okay, assuming that you are able to convert only 10%, I'm talking about 10%. If the disease prevalence is 80%, I'm talking only about 10% conversion. Okay, you are in a position to attract an additional revenue of 1 to 1.5 lakhs per annum only with your existing patients. We are going to help you with your digital marketing as well. Okay, we are going to install some clinic flyovers in your clinic flyers, and these flyers will be talking about your ability, and the certificate will talk that you will be certified to do this type of therapies. And with this digital reach, we will make sure that you will be spreading your information to your cluster of patients. That additional revenue is what we anticipate in a year to be anywhere between half to 1.5 lakhs. Right? Now, there are other solutions that we have, which we are marketing. But if you have patients who want to have this solution like SPAR, which is Students' Personality and Aptitude Review, that is the psychometric analysis for students, where we tell them even about their career choices, we tell them about their diet, we tell them about how parenting should happen. We also tell them about what are the preferred learning styles. Okay, based on that, we tell them what are the best options that they can opt for in standard 10. Science में जाना है, commerce में जाना है, science में जाना है तो engineering जाना है, medicine में जाना है, medicine में जाना है तो कौन सा medicine ज़्यादा उनको ये useful होगा, engineering जाना है तो कौन सा engineering field. That is one of the psychometric analysis that we do per person. If if you are getting patients for this, you get rupees 500 per patient because the charge itself is 2,500 rupees. Brain booster package, as I told, is a combination package, and we charge 20,000. you get 5,000 per patient. Bandhan, I'll share these details to you. What is Bandhan? What is Brain Booster? Bandhan is a package which is a counseling plus Panchakarma plus detox plus wellness programs for people who are getting married. जिसको आप बोलते हो कि प्रेपरेटरी, जैसे गर्भ संस्कार होता है, ये यू में से लग्न संस्कार है जैसे, right? So we prepare this and we are making sure that we are sharing the personalities of the patient of this couple so that there is increased compatibility. हम लोग उनको पहले से बताते हैं कि आप ऐसे बिहेव करिए, आपका पार्टनर ऐसा है, ये नहीं चलेगा, ये चलेगा, राइट? उस पे तो पूरा एक लेक्चर जाएगा, बट आई एम जस्ट टेलिंग यू व्हाट इट इज. So around about 3,000 per person, not a couple, right? Per a couple, it becomes 6,000. And so this gives you an additional revenue of around about half a lakh to almost like close to 1 lakh. So GPs with an investment, how much of 28,750 have a chance to boost their clinical revenue anywhere between 2.2 lakhs to 4 lakhs per annum, which is going to increase over the years as you master this science. This is the first year is what I'm talking about. Okay, the return of investment is 10 times. People who have Panchakarma setup or who do pure Ayurved, you have a huge chance to earn. It's close to around 3.5 lakhs to 6 lakhs and above. Why? Because one, you have a setup, you can do Panchakarma, you can do your conversion rate of patients is much better because you're already doing Panchakarma. There is no challenge for you, right? Bandhan will be easier for you to market. Brain booster will be easier. People will take it from you. Spar people will take it from you. Okay, existing patients conversion, there is no need for conversion for you. So here there is much more confidence in you earning anywhere between 3 and 3.25, 3.2 to 6 lakhs per annum. That is how we anticipate that it should be helping you. That is where I finish 2 minutes before my scheduled time. Now I will leave the rest of the time for you people to ask me questions. I want you to ask me anything that you feel is relevant, non-relevant, so that I can help you take your decisions. You want to type your questions, you can type your questions. You want any slide to be seen again, you can ask that. Any questions you want to type? Anyone interested in this can ask more questions. No questions?
Hello.
Yeah.
Namaste. Am I audible?
Yeah, you are audible.
Yeah, thank you. First of all, thank you, Sheryl ji, for your introductory talk. Excellent presentation. And most important is taking deep interest in the subject.
Thank you, sir.
My name is Dr. Ghanshyam Sharma. I work in the field of yoga. I did MD in Ayurveda, but somehow my role is I found the system of yoga is very powerful and I'm taking full benefit of this system. So I'm basically, you can say, I did my yoga therapy from Kevaledham in 1992.
Okay.
Then I was part of the Kevaledham medical team. I was part of the this thing, and then I started the yoga for mental health activity in Borivali area from 1993 onwards.
Wow, very nice. Good to hear that.
Yeah. So we basically train yoga teachers.
Good.
And I think your presentation will be very useful because the benefit of this thing is that yoga trainers are very contributing great in bringing mental health to the society.
I completely agree, sir.
Huh?
I have 2 to 3
Yeah,
who are in touch with me, and
correct, correct.
they work with me in my team.
And lot of yoga trainers earn well.
Yeah.
Huh? They earn well, and lot of people appoint them on one-to-one basis. Another advantage is, so they work like a personal trainer for them.
True.
Another benefit is them that they are repeatedly in touch with the customer. It is not a one-time, like if you visit the doctor, it is a one-time show. Huh? But here they meet the client 3 times in a week, 4 times in a week, and that goes on. Huh?
True.
So I feel if you organize yoga teachers training course on mental health, you will be great benefited. No doubt they are not doctors, but they play a very important role. They are also not, but you can call them, they are counselors, or they are, you can call them, we can call them, they guide them. Huh?
I got your point. I got your point. So I'll definitely work. I'll keep in touch with you. I'll once the
We
session
will
is
see
done.
what best we can do.
Sure, sure.
I
Makes
fully agree with you that mental health is a big problem. Big problem not only in our society, but many times in our own families also. Huh?
absolutely right.
And somehow we know more about the problematic mind, but we don't know anything about the healthy mind. Huh? And that is the big issue. Ki medical psychiatrists believe only in medicine. That is the big problem. And many of these medicines, they rather than the problem kills the patient. This is one. Another thing, the medicine kills the patient.
Absolutely right.
So I was very happy to see ki, I should have met you 15, 20 years back.
Yeah, true, true.
I am 60 now, 60 plus.
Okay. So we'd
So,
all
but
like to.
I have not seen anyone taking so much interest in such an interesting topic. So first of all, I'm very happy to meet you online because of this presentation. Very happy to know about your wonderful work which you are doing. I appreciate and looking forward to, let's see what best I can do for me, for my people, and for the society.
Great, nice to know you, sir. And it's
Yeah.
an honor to have you as well here. I'll definitely be in touch with you. I am not sure if you have registered so that
I will give you a recent example. One of my colleague, she was my batchmate. Her husband is one of the top chest physician of Mumbai, Dr. Prahlad Prabhudesai. Now, Dr. Prahlad Prabhudesai referred me one patient. Now, this boy is a brilliant boy, brilliant, really. He is doing MD in chest physician, medical college. But repeatedly, he is going into the phases of depressions. In 3 to 4 times, he became unconscious in the hospital.
Oh,
And you know, this poor boy this there is a Washi, there is a medical college. MG Medical College, MG,
yeah,
no?
yeah.
So
MGM.
from Borivali to Washi, every day he's going in taxi and coming in taxi. He can't, he is very afraid to stay alone. His father is a very well-known general practitioner in Borivali, MBBS general practitioner. And this boy was, Prahlad Prabhu Desai said, if something you can do to it right, then he referred me to this. I met this boy. We had a couple of yoga sessions. And I really felt very bad for this boy because out of 24 hours, 21 hours he is drowsy.
That's too concerning.
Drowsy. He he took break from the studies, but even study has a limitation. He got a ultimately memo from the college. If you don't come to the college and if you miss, you will miss 1 year.
Oh,
Now, recently, then he lapses, like what I want to say, the lapses are very common and there
yeah.
are very common. Maybe I will talk to him and maybe Cyrilji, we can do something for him. eh? I got a
Definitely.
message now after 2-3 months that, sir, I am feeling better now. I have resumed my college and we can meet sometime.
Sure, sure, sure. And we do have, similar,
Now this boy has all the medical facilities available. He is under the best psychiatric treatment of Mumbai. eh? But still, I feel handicapped, and this boy is really going through a tough task. Means I'm
yeah,
just giving you idea ki not only the patient, even our professionals are having so much of issues
correct.
and they don't know what to do.
Agree.
So
And I'm in sync with this. I'm in sync with this. The patient, as I said some time ago, when I referred Jabalpur, is a teenager, not a teenager, yeah, probably a teenager, who's an engineering student and he's in the final year. And similar background that you just explained. He had to force himself to be out of studies for almost like a year. And then, came to me all the way from Jabalpur, he along with his parent. And then today he's fine, he's graduated, and we talk. And then while there is maintenance therapy that is going on, which is not pharmacological, okay, but yes, we are in touch with him, and it makes a lot amount of difference when the the what do you say, these are the stem cells of our nation, the stem cells of our nation, that is the youth. And if the youth is suffering from this, then definitely it's a joint responsibility of all Vaidyas. And be it any pathy, we need to be embracing holistic medicine. We need to be embracing anything that helps this youth to be out of this deadly disease.
I also feel a little bit, you can say, I have a little bit questions about the Ayurvedic doctors. No doubt I myself is the Ayurvedic doctor, but Ayurvedic doctors don't refuse the patient. You know,
I understand. I got the point.
so that is, you say good and bad both.
Yeah.
Uh,
Yeah,
so
there are both the sides here, actually.
if you go to any Ayurvedic person, he will not say that in Ayurveda this I am not qualified or I don't have experience of this treatment, and that is the one of the biggest you can say hurdle.
Yeah.
Uh,
The psyche of not having a specialization, okay, or the psyche of being specialized in everything. Okay, that is killing the whole infrastructure of Ayurveda, is what I feel. Because right now, what I felt is the reference won't come as easy as a reference from a homeopathic doctor would come, or from a psychologist would come. Today, as of today, that I stand, one of the largest contributors towards the references was a PhD doctor, but he was a psychologist. I mean, he is still doing that. He is a psychologist. And maximum patient flow has been from this person than from people who are psychiatrists. Forget Ayurved people. It's the second highest toppers are the homeopathic doctors who have referred me the most. Ayurved कहीं तो कभी तो आता है ऐसा पेशेंट आता
yes, very true, very true. I run a medical yoga center in Borivali area.
है. हाँ.
I don't get any referred patient from any Ayurvedic or allopathic doctors. It is only the word of mouth, patient to patient, my name goes and they come to me.
Okay.
So,
So what I'll do is, actually,
sorry to taking time.
No, you are not taking time. Please go ahead.
Yes, sir. Looking forward to know about you and your wonderful journey and wonderful work. Thank you.
Sure. And if you don't mind, I don't know if you have, registered yourself so that I can get your number. If you have not registered, I would like you to drop your number in the chat box, either to Sarika or to me, or in the group.
Okay.
In the group also is fine, because the rest of us will also benefit. The group members will also benefit if they have to refer any specific cases to you. So if it would be appreciable if you share your numbers, and I'll contact you soon. So I think we can end this poll as well. Not many people, I think. It's almost like 24 minutes that you have posted this poll, right? कितना मिनट हुआ? अभी पोस्ट किया क्या?
Minutes, yeah, 6 minutes. So one person has answered. Sunil Kumar is not able to see. So just toggle the screen and check. The poll will be displayed on for you. Or you can just answer to me here on the chat. It's about the enrolling to this program, yes or no.
So let me paraphrase this question to all of you. If you wish that, this is going to help you increase your numbers, as I told you, I'm not sure if you had a time to look at or you could read my bio, but I come from the statistics background. I've done my Six Sigma Black Belt from Indian Statistical Institute. So when I put up numbers, either they are very close to real or they are sub-real. Sub-real का मतलब क्या है? They will be lesser than the real. Okay, I would not want to inflate the numbers. तो अगर आपको लगा कि ये इनकम क्या है, सिर्फ 2.5 लाख और 6 लाख तक ही बढ़ता है, तो वो बहुत बहुत सब नॉर्मल नंबर्स मैंने लिखा है. अगर आपके पास कैपेबिलिटी है, आपके पास इंटरेस्ट है, तो ये बेयर मिनिमम तो होगा. उसके आगे sky is the limit, right? As I said, if the Thane center can reach in 1 year 110% of the revenue that it generated in the past year, then you people are more in touch with patients, right? So your income will be much more better than what the Thana center that we run actually has encountered. So it all depends whether you are. And if you have any questions, my number will be flashing. It's there on the screen. You can call us at that number for anything that you need, because this is not something that you need to take a step right away. You don't have to decide whether you want to join this course now. Okay, you can have questions, because there'll be so many questions. Ask these questions, clarify things. This is the number that you can reach out to me. Okay, if I am with my patients, then my assistant would be attending that call, and I'll call you back as soon as I'm free on this. Okay, do you have any other questions that you would want clarity? Should I wait for a couple of more minutes, or should we sign off for today?
I have one question, sir.
Yes, sir, please go ahead.
How successful our medicines are?
How successful
our Ayurvedic medicines are?
Oh, that's the reason I said, if you can go to our website, to answer you very precisely, they are very successful.
Okay.
Not because I am practicing. To be very frank, I've been practicing, multi-pronged therapies right from my graduation times. Okay. So I used to be called as an oral surgeon by Dr. Nagral. नागराल का नाम तो आपने सुना ही होगा. हाँ, तो मैं उनको असिस्ट करता था यहाँ पे साइन पे, और उनके शिष्य जो वो मेरे गुरुजी है डॉक्टर राजेश गुप्ता. ओके, तो वी बीन इन टच फॉर दैट फॉर लॉन्ग, एंड मैं मॉडर्न मेडिसिन से काफी प्रभावित था कॉलेज फेज में. आई यूज टू प्रैक्टिस अ लॉट एंड टिल डेट आई यूज इंटीग्रेटिव systems of knowledge when I'm trying to understand as well, propagate Ayurveda. But the thing that I've seen with antipsychotics, the thing that I've seen with stimulants, the thing that I've seen with anxiolytics versus what we have, versus the therapies what we can design, they're a lot better. I can definitely say that. Only thing what lacks is the patience of the patients, the time and the trust that these people have. Second is the awareness that Ayurveda can treat psychiatric disorders. Okay, the people who have been ardent Ayurveda followers, it's okay for them to wait for 10-15 days. If they've waited for 15 years, why can't they wait for 15 days for the Panchakarmas basic thing to be done, and then we start with oral medication? Then they see the differences. Within a month or so, they will be in a position to say that, yes, we want to convert completely into Ayurveda.
Okay, sir. Thank you.
Yeah, you are most welcome. Okay, guys, thanks a lot. I'd be happy to answer any question on my phone number or even chat. That's also a WhatsApp number. And Sarika, madam is also there. So she has already posted her number in the group. You can ask her questions as well. She is my team member. We both work together. She's as I told, she's a life coach. She's a professional life coach. She's also trained in emotional intelligence, and most of my patients, whenever they're admitted, she's the one who will want to take care about it. So I am happy that you participated in this session. Thanks everybody. And there's one message. Let me see that. Okay, Dr. Ghansham Sharma has enrolled. Is Sunil Kumar. Sunil Kumar, the fees, as I said, is 28,750. If you see on the, it's just the training fee and whatever nominal requirements that we have for onboarding you. Okay, medications and all will be provided. The kits will be provided to you based on the Prakriti, based on the Vikruti. Okay, all the kits will be there. You just have to select it and send it to the patient. Okay, there is not much of headache for you, but you have over a period of years, maybe after a couple of years, you feel that you want to use your style of medications, you want to add or delete, you're free to do that. Okay, we will be providing you with marketing support. All digital signages will be done by us. All digital print material designs will be provided by us. You will have to just print it and put it across in your clinics. We'll have a visit to your clinic as well. We'll suggest you a few things. We will do shadowing, that is consulting भी, psychiatric consulting कैसे करने का उसके लिए भी हम लोग आपको ट्रेनिंग देंगे. We will do shadow consulting. Shadow consulting का मतलब क्या, आप कंसल्ट करोगे, मैं भी वहां पे रहूंगा, या मेरा टीम मेंबर कोई तो रहेगा वहां पे, या सारिका मैडम रहेगी वहां पे. Okay, either it could be an online presence, and if you're around, we will be there traveling to your place if time permits and if the situation arises in that particular requirement. ठीक है?
Sir, this course is online, offline?
It is online, and for people who are around, we will be moving to their clinics for any shadow consulting. Shadow consulting का मतलब क्या है? You will be asked to collect your patients on a particular Sunday, and either me or one of my team members will be there to do the initial consults so that you will do a shadowing on that.
Okay. And these theory sessions are every day? How many days in a week?
They are only on weekends, only on Sundays.
Okay, only on Sundays.
Yeah.
Okay. Okay. Okay, thank you, sir.
Yeah, welcome. Thanks a lot, guys. There are two people who want to enroll. Please put a message on the number that is flashing on the screen right now so that we can identify you and share the details. Okay, this is the number.
Okay, may I leave the session?
Yep, sir. Please go.
Okay. Okay.
Thanks for attending. This is the number, guys. Please make note of the number. I'll be flashing this number for another 1 minute or so, and then we'll sign off for the day. I thank you from the bottom of my heart for attending this. And one simple request, please spread this word. We need this to be at least known to people who are Ayurved graduates so that they can spread it across to other people who are interested. So kindly share the post that I have shared with you. And a recording of this will be available. If you want others to listen to this recording, you can share the link of recording to other Vaidyas as well. Okay? Thanks a lot. I'll be signing off. Have a nice Sunday evening.
Thank you all.
Thank you, Sarika. Thanks, everybody. Bye-bye.
Thank you. Bye-bye. Have a nice Sunday.